Good evening. Welcome to today's episode of NTV's weekly chat show, Talking Point. I'm your host, Syed Neaz Ahmad. Whenever we meet anybody, we ask you, how are you? And he says, fine, thank you. But at the back of our mind, we never think, what is fine? What is the meaning? Is it physical health? Is it my business health? Is it my relationship with others, or is it my mental health? See, in our studios today, we have a psychiatrist, Dr. Amanullah Shaikh. He is a retired consultant in child, adolescent, and family psychiatrist. Just before the program, I was talking to him about the various aspects, and as I said, a healthy mind in a healthy body. He corrected me and he said, there is no health without mental health. Well, let's see more of Dr. Amanullah Shaikh. Welcome to the show, sir. How are you?
Thank you. I'm quite well.
So kind of you that you have accepted our invitation and you made time for us today. The first things first, see, I would like to ask you, what motivated you to join this profession? Where did your medical life, your journey into the medical profession begin?
I haven't asked this question myself
Somebody had
for
to.
some time. Now you have asked. I think it started quite early on. When I was a 5 or 6 class student, I had a dream that I want to be a doctor. So it was quite early on I made a decision that I want to do medicine, I want to study medicine. So I had a lot of obstacles and hurdles to cross, but never gave up wanting to be a doctor.
And you went to the school in Bangladesh, medical school?
Yes. I had a bit of a roundabout way. I went to school in Khulna July School. I had a very good result in matriculation examination. In those days,
Yes,
we used to
that's
call
what we would call
matriculation
O-levels or GCSE.
O-level equivalent. I had very good result. And my father said that we want to send you to Dhaka College, which was at that time quite a prestigious college. So I went to Dhaka College, and there I got a bit deviated and I didn't do very well in my intermediate ISC. So I went to medical school. In those days, medical schools were
old Dhaka.
Old Dhaka, and I went to medical school in Mymensingh, qualified as an LMF doctor, and then in Dhaka, the new short course to become a MBBS doctor started. So I joined there and did my MBBS. So I went in a bit of a roundabout way. So after qualifying as an MBBS doctor, I did the usual training of house job, and then I took a government job in Rajshahi, I think I went. But I didn't like it. It was quite an unstimulating job, and I didn't like. So I went into industry, jute industry. As a chief medical officer, I worked in the jute industry for quite a while.
Yeah.
And during that time, I also applied for UK training. And at that time, I decided to become a psychiatrist and applied for it. But
What was the motivation that you decided to become a psychiatrist?
motivation was that normal medicine, surgery didn't
They
appeal to
stimulate you,
me
yeah.
too much, because those subjects were so technical and become technician orientated that human personality was not considered at all. And I felt that medicine has to be a holistic medicine. It must contain the emotional aspect and the mental health aspect and the whole person. I thought that medicine was lacking in that approach in those days. Later on, medicine improved and they have taken on
It's
the
more of an attitude, isn't it, on behalf of the medical profession?
And I think, I mean, as technology advanced so fast, they got hooked up in the technology and did not consider mental health or psychological aspect of people's suffering very much. So I thought that to be able to treat human being as a whole person, I should know mental health, and that's what led me to study psychiatry.
So treatment of mental disorders were not of great value those days back in Bangladesh.
I think even when I came to this country,
Yeah.
I found that mental health was lagging behind, was falling behind, far behind. And even in England, we started a lot of new mental health issues and modernized mental health issues are emerging in my early days. There was, as you know, there was huge big asylums where very severely mentally disordered patients were locked up
Yeah.
and kept there forever.
I have also heard of electric treatment.
Yes, electric treatment has been available for a long time, and it was practiced even 10 years ago. Nowadays, we don't use electrical treatment. But in my training time, I have used electrical treatment. ECT, we call.
Is it used to calm down the patient, or?
I mean, the history is quite a lengthy one, but I would say that it worked for depressed patients quite well.
Yep. For how long? For a short time?
Because at that time, the antidepressant medications were very primitive and they took a long time to work. And in that respect, a suicidal depressed patient who needs treatment immediately, electric shock was very useful.
Readily available.
Readily available, and they brought them back from a suicidal state to a lot more normal state.
Yes.
And then the medication also start working. So electrical treatment is still available.
It sounds a bit primitive, isn't it?
It is.
It sounds a bit primitive.
It isn't. It isn't. I mean, it's very modified now. It's an electric shock given under anesthesia. So it's given in a very humane way, not like previously when it was like a torture.
Dr. Shaikh, there's a lot of question in my mind. People don't seem to understand what is psychiatry. what is a psychiatrist's job. They confuse between psychologist and a psychiatrist. They say. Would you explain?
Yes, yes. I think there is a marked difference between psychologist and psychiatrist. A psychologist is a psychology graduate from university. They may do masters in psychology. A psychiatrist is basically a medical person, is an MBBS doctor.
With further training and qualifications.
Then they go on to psychiatric training. And the obvious difference is that a psychiatrist can prescribe medication.
Yeah.
A psychologist cannot, do not have the license to prescribe medication. So those are the two main differences. But I think in case of mental illness who are treating, I think the psychologists use more psychotherapeutic line and behavioristic line, behavior modification line, and they treat rather in the lower end of the mental illness, like anxiety and manic depressive psychosis becomes a very severe illness which requires medication, and they come under psychiatrist. But anxiety state, phobic state, and people who have obsessions, these are better treated by psychologists in a psychological method and behavioristic method.
When we talk about normal and abnormal persons, I mean, what is abnormal to somebody could be normal to me, and what is normal to me could be abnormal to somebody. So where do we draw the line?
I think there are those areas, but I think if we look at general population, the psychological problem can be a continuum. Some people may have very minimum of psychological problems. Others may have severe psychological problem. So it is a scale of severity that makes a mental illness. We all have some mental health problem.
We all have some physical health problems.
I am sure there are physical health problems. But mental health has got a stigma that he is a mad person, or equivalent to madness, and very serious, perhaps violence, and all those sort of things. Although mental health patients are not any more violent than other non-mental health people. But these stigmas have become so common that people and media has not helped very much. If there is a mental health patient has killed somebody, that becomes a huge big news.
Right.
And
why was he let loose in the community?
They all become convinced that all mental health patients are murderers. But that is not true.
But can we blame the media for that? I mean, I would rather think
I cannot blame actually, but it is a sensationalization that creates media interest.
That used to sell newspapers.
Yes. So this sensational news goes against the mental health patients very much.
How can a normal, quote unquote, person understand? I mean, it's a non-medical person, he can understand and distinguish the symptoms of abnormality?
Again, I mean, it's a huge, big question you've asked. Um, you see, if we take the biggest problem in psychiatry is schizophrenia. Schizophrenia is something which still remains mystical. We still haven't discovered what causes this and what is the curative treatment for it. If you look at medical literature, half of the medical literature you will find written on schizophrenia. So it's a vastly discussed and researched, and still we are in darkness to discover the cure for it. So schizophrenia is a severe mental illness. It also varies in degree, but in the severe end, a person perhaps hears voices.
Yeah.
The ordinary people will notice that he is answering to voices.
Yeah, somebody invisible.
He's talking to nobody when there is nobody around. So that can be quite an odd experience, both for the patient and for the people who are around them. Schizophrenics do not have the ordinary emotional expressions. If we are happy, we laugh. If we are sad, we feel a bit sad, and
the facial expression changes.
Facial expression changes, the language changes. Schizophrenics don't seem to have this discrimination of what is sadness, what is happiness. They cannot discriminate. They become
but
flat.
Why?
Flat.
Why? Can't they accept
Again,
that?
I cannot answer you. Increasingly, we are realizing that there must be a brain disorder.
Yeah, there's a block.
Brain chemical disorder. We haven't found it yet. But modern medicine do suggest that there are very useful medication which controls this hallucination. Say, hearing voices just suddenly goes with medication. So there must be some brain disorder.
Yeah.
And that is increasingly being recognized.
Right.
But schizophrenia is a brain disorder.
Right, coming back to your specialization. Okay, sir, we have nearly come to the end of this segment, and we have to take a break, and then when we come back, we will come back to your specialization, area of specialization. Thank you for being with us. We will still be here, inshallah. Don't go away, we'll be back soon.